Welcome to another episode of Easy Access to Healthcare for All, a program which brings you news and issues around the National Health Insurance Authority as it drives Nigeria towards universal health coverage. A key stakeholder in the quest by the NHIA to attain universal health coverage is the World Health Organization, which plays an integral role in providing not only the technical but also financial support to partners like Nigeria. The organization recently embarked on a week-long health financing mission to the NHIA to render support towards the implementation of the new NHIA Act. Details of this visit make up a major part of our program this evening. I am Aisha Muhammad Ahmed, your regular anchor on the program. Stay tuned for this and more when the program continues after this timeout.
President Muhammadu Buhari has signed the new NHIA Act into law, which makes health insurance to be mandatory in Nigeria.
One of the reasons why we decided to gather here,
familiarize ourselves with the contents
of the Act,
is entirely a watershed, a new beginning.
It's going to be a transition between the National Health Insurance Scheme to the National Health Insurance Authority.
And then start preparing for how we are going to implement it.
First on the program is a highlight of events around the NHIA. In the news, NHIA sensitizes NOA officers in Kaduna. These and more coming your way shortly. Please stay tuned.
The National Health Insurance Authority has held another enlightenment and sensitization program for the National Orientation Agency NOA field officers. The two-day program held in Kaduna State between the 27th and 28th of July 2022 in Kaduna. Declaring the program open, the Director General and Chief Executive Officer of the authority, Professor Nasir Sambo, said he believes that the collaboration between the NHIA and NOA will accelerate the comprehension, acceptance, and uptake of health insurance across the country. The DG CEO, who was represented by the Zonal Coordinator Northwest Zone A of NHIA, Hajia Umul Khair Sada, noted that the NHIA remain committed to the attainment of its mandate, which is universal health coverage.
This collaboration could not have come at a better time, in view of the fact that a lot of reforms are taking place within the NHIA and the health insurance ecosystem over the last 3 years. These reforms include, amongst others, the development of a strategic plan for the system, the development of a coordinating framework called Health Insurance Under One Roof, and the ongoing eNHIS project, amongst others. The task of providing health insurance coverage for over 2 million Nigerians all over the country is by no means an easy task, especially in the light of current social and economic challenges.
Also speaking at the opening of the two-day event, the Director General of NOA, Dr. Garba Abari, who was represented by Mr. Kehinde Ogunkwade, said the NOA is delighted to collaborate with the NHIA. He urged the Community Orientation Mobilization Officers, COMOS, to ensure that the information is well disseminated to the grassroots.
It's a policy NOA that you don't give what you don't have. Hence, this learning process has come for us to know what it is that we take to the grassroots. We must deliver the message as we are sent.
The program featured several presentations on the new NHIA Act, policies and programs of NHIA, among other papers. There was also time for questions and answers. A team from the Edo State Office of the National Health Insurance Authority, NHIA, led by one of its officers, Raymond Uyi Ohomba, visited the NYC orientation camp to sensitize the core members on the group, individual, and family health insurance for NYC members, Give, Ship, N. Mr. Theo Ehanire, who was part of the NHIA delegation, gave a presentation on the gift-ship N, which he said is to help serving core members have access to adequate and quality healthcare services without having to pay out of pocket. He also enlightened core members on registration processes for the gift-ship N, as well as its benefit package. Mr. Hanere further re-emphasized the means by which core members' healthcare needs will be attended to throughout their service year and the grievance redress mechanisms available. At the end of the sensitization session, the core members were given the opportunity to ask questions and answers were provided.
The program is easy access to healthcare for all, bringing you news and issues around the National Health Insurance Authority. Like I mentioned earlier on, the WHO was on a health financing mission to Abuja. The essence of the visit and what it intends to achieve make up our next segment of the program, Issues Around the NHIA. Keep watching.
The National Health Insurance Authority is a healthcare financing intervention. It is a demand-side intervention that pools revenue to purchase care for enrollees. However, fulfilling its mandate has not been an easy task because of the limitations of the law establishing it. On the 19th May 2022, however, President Muhammadu Buhari assented to a bill which has made health insurance mandatory in Nigeria, putting Nigeria and the NHIA amongst countries working tirelessly towards the attainment of universal health coverage. It is towards this end that the authority received a high-level World Health Organization delegation at the NHIA headquarters in Abuja.
For the purpose of this meeting, ladies and gentlemen,
The visit, which represented WHO's commitment to the NHIA as it begins its march towards the attainment of universal health coverage, it was also to identify ways the organization can support the NHIA. The week-long visit was characterized by activities like advocacy visits to the Office of the Secretary to the Government of the Federation, Minister of Health, as well as the National Assembly, amongst other partner ministries, departments and agencies.
the first one that I visited.
While speaking at the NHIA headquarters, while they were received by the DG, leader of the delegation and WHO's country representative in Nigeria, Dr. Walter Kazadi, said the WHO will do what it can to help in the operations of the new NHIA Act.
Today I'm here because there has been a new development, the NHIA Authority Bill. And I'm here again because I believe that's the way to go. NHIA hold the promise to transform health access to healthcare in Nigeria. So this is really a good opportunity for us, and it's a privilege indeed, to be part of this high-level advocacy visit, to review where we are so far, how we will operationalize this new health insurance authority bill, and how WHO can further support to strengthen NHIA to deliver on a mandate.
In his response, Director General of the NHIA, Professor Mohamed Nasir Sambo, expressed his delight over the visit. He said healthcare is a critical element of development, and the best way to achieve universal health coverage is through financial risk protection for health insurance.
And if you look at the Sustainable Development Goals, the SDG 3 is the most elaborate element in the SDG, and is talking about universal health coverage. And globally, it has been acknowledged that the best way to attain universal health coverage is to ensure that you provide financial risk protection to people. And the veritable mechanism of providing financial risk protection to people is through health insurance. Nigeria has been operating health insurance for the past 23 years. The first 20 years is bedeviled by a lot of problems which we are going to see in the presentation. but the last 3 years has been very, very remarkable.
Professor Sambo also gave a presentation titled Repositioning the NHIA for Universal Health Coverage to explain the evolution from NHIS to NHIA.
The old NHIS, why do we call it old NHIS? Because the landscape was old. This is the time when the decree of health insurance was promulgated by the military. It was called Decree 35 of 1999. And the operations of the health insurance commenced in 2005. There was a gap of 6 years between when the law was established and when the actual formal sector program commenced operation. But because of so many problems that bedeviled the agency then, we could not move forward.
The defining moment of the WHO's health financing mission was the strategic engagement with the Secretary to the Government of the Federation, Boss Mustafa, who appreciated the WHO for its constant support for Nigeria. He acknowledged that making health insurance mandatory will go a long way in ensuring an easy life for Nigerians. This is even as he pledged his unwavering support for the implementation.
So I want to thank Prof. and also the agencies that worked with you, because I know that it's a combination of agencies like WHO that worked with you in crafting, based on experiences of other jurisdictions, to craft a legislation that will serve our people. So I want to thank you for this visit, and whatever we need to do to resource this coverage in this particular budget, either by way of a special intervention or by way of providing for it in the appropriation, I think so. Whatever they are, I know that we have conflicting and competing demands, but the health of our people must be on the top priority.
Another interesting activity was the meeting with the Minister of Health, Dr. Osagio Hanere, and members of his team. Discussions focus on the sustainable financing for universal health coverage in Nigeria and the operationalization of NHIA Act. Dr. Osagi appreciated WHO for its support as he highlighted a few areas where support can be provided.
So there are many ways in which you can support us. When you meet with governors, when you meet with Minister of Finance, when you meet other development partners, to have to increase their interest exactly where the problem is. It's at the rural level, it's at the suburban level. The slums. So that is where we want to develop and we say that all the time, and I think it will help us with our partners and resource like we also make that emphasis. Today I told the governors it's time to bring your gaze lower from good big that shiny humble PHC because that's where the problem is, and that is where the path to universal health coverage. You can help us with that.
There was a visit to the National Assembly to discuss issues of advocacy and implementation of the new Act with the Committees of Health. Other activities during the week-long health financing mission include an engagement with DG Budget, a visit to the FCT Health Insurance Office, a visit to Garki Hospital, Abuja, dinner with the NHIA team, amongst other activities. At the end of the visit, the WHO delegation shared their perspectives on the NHIA and its readiness for the attainment of universal health coverage.
What we've seen here shows very important and, in a way, forward-looking investments in the infrastructure, especially the information technology infrastructure that will be needed to enable the system to be efficient in how it extends coverage. There's obviously a long way to go in terms of actually enrolling people and making sure that everyone is able to get the services they need without fear of financial hardship.
Now the passing of the law is already a very strong step in this agenda to make sure that everybody accesses health services. Because when we talk of UHC, we are talking of services primarily, and alongside that, financial risk protection. So I think the readiness is there, the political will, because we had a chance to visit the Senate. We had a chance to meet the Minister of Finance. And I'm impressed personally by the alignment of the commitment, the alignment of the vision, the energy of the team working long hours.
Welcome back from that timeout. Just before the break, we took highlights of WHO Health Financing Mission to Abuja, and you will agree that it was a very productive engagement. The program continues with our Stakeholders Corner, and this evening we'll bring the chat with Dr. Agada Zubueni of the Bayelsa State Contributory Health Agency, a partner with the NHIA in the attainment of universal health coverage. Dr. Agada explains how state healthcare agencies operate.
Most of the state health insurance agencies, like Bayelsa State, operate almost like the National Health Insurance Scheme, in the sense that the empaneling of hospitals and enrollees into the health insurance scheme is the same. The payment mechanisms or reimbursement mechanisms, as they call in health insurance parlor, is the same. And so it's almost the same. If there are differences, they are very slim with regards to operations.
He shares his thoughts on the concept of health insurance under one roof.
Health insurance under one roof, as orchestrated by NHIS and those that help in putting it together, is to bring the whole aspect of health insurance in the ecosystem into one, under the direct supervision of the National Health Insurance Scheme, and the ease to pass messages and ideas to all the operators at the same time. So every aspect of health insurance, both HMOs and state insurance systems, are brought into one ecosystem.
Agada also speaks on program and persons covered under the Bayelsa State Health Insurance Agency.
The coverage cuts across the formal and informal sector, as the same with NHIS. So the civil service of the states, the corporate organizations, and small, medium, and small-scale businesses, as well as private individuals who are urban self-employed or who may not even be able to have any means of earning, are all participants in the health insurance program, including dependents. And we should remember that when it comes to the formal sector, the dependents are co-insured by the principals. But for the informal sectors, the dependents are paid separately by their guardians and whoever is taking care of them.
He also speaks on how the NHIA and the state health insurance collaborate.
A lot of collaboration, just the way I'm here in NHIS, regular meetings and certain operations that we need assistance from NHIS, we get them. In our meeting with them for this period is on training of our staffs and capacity development and personnel development, as well as certain assistance in certain other activities in the different states. Now, the most that brings us closely together is the Basic Healthcare Provision Fund, which is a direct operation from NHIS down to the state health insurance schemes, who are the field operators, while NHIS is the so-called gateway, which is the financier from the fund itself.
In conclusion, Dr. Agada speaks on peculiarities of the use of third-party administration instead of health maintenance organization in Bielsa.
Difference is that in the HMO system, regular monies are regularly passed to the HMOs according to the number of lives they are having, and the HMOs manage that money. And that is why you see delay in payments and all of those things. But for us, we manage it ourselves. So every financial responsibility is on us. It's on us. So it's easier for us to interact with the hospitals head-on and then get things sorted out. And it is also smoother for us to do reimbursements.
That was Dr. Agada of the Bielsa State Contributory Health Care Scheme, speaking from his experience as a stakeholder in the attainment of universal health coverage. Up next, your questions answered.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled? How can I get enrolled?
Question: how do enrollees access specialist care?
For specialist care, the enrollee will first attend at their primary provider, which in NHIS parlance we call the gatekeeper. So you go to your doctor where you have registered, and then the doctor, if sees anything necessary, will refer that enrollee for a secondary service. If the hospital offers that service, then there will be an internal referral. However, if the hospital does not offer that service, then it's referred to a center where that service is offered, and the hospital, therefore, in both cases, the hospital will actually get in touch with the health maintenance organization, who will actually issue the referral code, and then the hospital gives the notification of the referral to the patient, who either goes to the internal place if the hospital offers the service, or goes to the other service provider that actually offers that specialty service.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled? How can I get enrolled?
This is where we draw the curtains on this episode of the program. If you have questions or comments, please send them through any of our contact mediums on your screen. You can also watch the program anytime, any day via our YouTube channel. Join me again, same time, same station for another episode as we continue to bring you more stories of happenings around the NHIA. See you next week.